See, sometimes in life, we don't realize when things happen slowly on a day-to-day basis, we tend to think that this is not a major problem. And so many incidents keep on happening at a hospital level, either which result in a minor harm, major harm, or sometimes loss of life. But because it is so distributed, we never feel that this is a disaster. To me, really, this is one of the largest disasters that's happening in healthcare. There is enough data to suggest that it kills more people than any of the top causes of death, which is illness related. So I think it's time we take cognizance of this huge iceberg that is there in terms of errors that happen at the hospital level, which lead either to morbidity or mortality, or increased cost to the patient, or sometimes loss of life. My talk is about simulation education and its effect in reducing errors. I think this is a very, very important area to look at how we can reduce errors. If we look at what are the common causes of errors, most of the times it is fundamental lack of anticipating that there could be a problem. Secondly, not having the right skills to do it. And the third part is, even if you have the skills, you don't actually deliver it in the right manner. And there are various factors to it, because traditionally we have been taught to take care of patients by giving lectures or just working on a dead body and doing things where neither the patient feels nor talks, or neither the person who is giving care understands what the patient is feeling. This causes a lot of problems. The way we are taught and then the way we are expected to deal with patients is totally different. And this actually creates an atmosphere for people to go wrong. I think simulation is basically, simply putting, copying of the exact situation that you would be facing in as a doctor when you see the patient, or what the patient would be facing in when he faces the doctor. So you actually create the whole situation of a patient-physician encounter, a patient-nurse encounter, and then look at all aspects of it: the communication part of it, the clinical part of it, the skill part of it. All of these three things put together, what we call in adult learning domain as the cognitive domain, the psychomotor domain, and the third part is affective, that's the attitudinal domain. All these three things, and more importantly, the teamwork. It's so sad that all the stakeholders, doctors are taught separately, the nurse is taught separately, the EMT is taught separately, and when the patient comes, we are supposed to take care of them together. There is no way team players can do together at the last minute. They should be working together right from the initial part of the game. You have the response. You call a service, we should be able to reach in time with the right kind of equipment, right kind of people, right kind of training. It's not just about a white thing on four wheels and put a label of ambulance. You need to have right kind of people and right kind of equipment. And then when you shift the person, you have to shift him as if you are shifting something very precious. There is no need to speed up the ambulances. There are enough accidents that are happening as far as the ambulances are concerned, which are over speeding. It doesn't make a world of difference. As long as you drive safely at a reasonable speed, immobilize the patient properly, and then transfer to the hospital in the right manner. Once you reach the hospital, obviously the hospital, if it gets a pre-arrival notification beforehand, it makes a world of difference. If I know that I'm going to get a patient in 5 minutes, it makes a world of difference for me. And then the team of people who are going to be taking care must come together, what you call as a trauma team. You have the emergency physician, you have the EMT, you have the nurse, you have the X-ray technician, you have the OT, which is informed that we might have to do an emergency surgery, and we also calling for the specialist backup. And all of these people must be trained together on specific training programs like advanced trauma life support skills, so that all of us are trained and they speak, assess and manage exactly in the same manner. So basically, Apollo is one of the pioneers in simulation-based education in this country. We have a full-fledged simulation lab, a very state-of-the-art skills and simulation center. And we conduct training programs right from the community. We call this as a lifesaver program for bystanders. Then we train the lowest medical students Apart from the didactic lectures in the medical school, they come and translate it actually onto patient care. We do training for nurses, we do training for junior doctors and for senior physicians, from very basic encounters to the most complex things. And one of the most important areas that we highlight is communication skills, the way doctors talk, the way team behaves, the way the patient perceives their interaction. It's not good enough to be a very brilliant doctor. The patient has to feel that you are doing good for him.